Hi, you. Hi, it's Carrie here. Care for eyes to see. You, me. Hey, I already titled my video in my head before I turned the camera on. Eating humble pie, part 3. I've done 2 other parts. It's about my biopsy on my nose. Let me see if I can get up here closely. You can see. Okay, I have a piece of paper I could show you, but just got it from the doctor who did the biopsy, and she says some things that I really don't want to read to you. It very should I read them to you? Let me get it. Hang on just a sec. Okay. There it is. Okay. Let me start. The pathology report from the biopsy conducted at our office confirmed that you have skin cancer. Please see the enclosed pathology report. We recommend that you seek definitive treatment. We also want you to know that the long-term risks associated with delaying or foregoing treatment. We also want you to know the long-term risks associated with delaying or foregoing the treatment, because I told them I did not want the Mohs procedure on it. I don't want to do the cut some skin and flip it around and place it on my nose and it should grow back better. So skin cancers are invasive, growing, and non-healing. That's pretty big. If they are left untreated, they will continue to grow and destroy the surrounding tissue. The longer one waits to treat a skin cancer, the more difficult and extensive the surgery will ultimately be. In some cases, it is also possible the cancer may metastasize and spread to other parts of the body, potentially resulting in death. Wow, that's kind of scary, huh? Okay. You know, that's what that's what she's taught. Okay, guys, I don't want to be humbled and say cancer doesn't scare me. Okay. This is God's story for me. This isn't about I've got a cure. I know what cancer's about. Not me. I am one humble crow here. I don't know if that's the right. I don't know if anyway. You know, eating humble pie. I would much rather eat humble pie than eat crow, right? I have an old dear friend. I married one of his sons and was married and had 3 kids with him. But that's beside the point. Anyway, that was a long, long time ago. But I'm still, I saw this father-in-law, right? I saw him recently. He's an internal doctor, an internist. And he looked at it and he said, don't do it, Care. Did I already tell you all this? Sorry. But, excuse me, my nose is itching. I don't believe what's in that letter. Possibly. He told me that basal cell carcinoma does not spread like she just said in that letter. But she has told me, not in that letter, but has said that it's basal cell carcinoma. So we're excuse me. Were it to be melanoma, I could possibly agree to the Mohs procedure, but then even then, I'm just not convinced it's better than urine therapy, right? Because, and I have another story that I want to tell you. I want to do another video soon, maybe today, talking about a story with my sister Claire. Claire's story, maybe we'll call it, because it's a good one. It's one that's gone on for 16 years and very convincing story. So, I mean, I'm rambling a little bit, but I'm not having surgery on this, guys. And if that leads to death, which she said, I don't want to put it up here because I'm not going to talk bad about doctors or companies or anything like that. They don't really know. They don't understand that. Well, I think it could be true for people unless they were doing urine therapy like me, you know, like do what I did. No, it's not like that. Urine therapy is a very clean, pure way to cleanse. As soon as I decided not to do this surgery, I washed my face with warm water and a couple of big chunks of this part she didn't biopsy came off. It was wild, and it started bleeding. That's why I have some spots that are healing from like scabs on there. It's interesting stuff, and they put it in ways that makes a normal person scary. If I was not drinking all the juice that comes out of my body, I would be scared. I seriously would. And I would be, you know, hands up, do what you guys got to do. Right? I'm not going to do it, guys. I am not going to. I just don't buy it. It's not really a death sentence, cancer. And I'm not saying you shouldn't buy it if they've given you a diagnosis of the C word. You know, I would just say drink your pee any way you can. Every way you can. Inside out. You know, drink it when you drink it from the inside, which means you just don't pee and you just hold it in and it drinks itself inside. You can do it for hours. I'm serious. Yeah. I haven't brushed my teeth today. Sorry about that. But my breath is kind of. Hey, thank you for listening. I wanted to update you so that you know absolutely transparently what I'm doing. You know, she did slice off part of that, which is what I've always said, and I've even said it to doctors. I think the knife pisses cancer off, and it might do something. But I do also agree with the doctor I talked to who said basal cell doesn't spread. You're doing okay. He said you're doing it, actually. He saw me a year ago. I would trust his opinion more than, well, you know, I'm not going to say it. Thank you for listening. If you're still listening, thank you in advance for your thumbs up. I'm glad you guys are subscribing and watching my videos. Everybody says it helps with the algorithms and all that. So, yeah, it's a great day. I'll talk to you soon, and I'll keep you posted on this. Take care. I love you guys.